Everyone, this is Vicky from Niper. In this video, I will discuss the most important topics to study in pharmacology for GPAT 2025. So, focus on the general pharmacology, study about enzyme inducers, inhibitors, the different phases of clinical trials, the definitions of essential drugs, orphan drugs, antagonism types, synergism, etc. And study the human teratogenic drug table, which is in page number 100 of KD3 Party 8th edition. So very important, focus on general pharmacology. 1 to 2 questions will come from general pharmacology and also study the ADME in general pharmacology and cover the receptor pharmacology also. We can expect 1 question from receptor pharmacology, all the GPCR receptors, all the receptor pharmacology, and study about the glaucoma anti-adrenergic drug classification, mainly on the beta blockers, the specific indications of their beta blockers, and study the MOA and classification of glaucoma, very important, and study the classification of histamines, the first generation and second generation histamine classification, the highly sedative, moderately sedative, and with the specific indications also, and study the serotonin classification, very important. 1 question will come from this classification of serotonins with examples also, and study the Cox pathway and their NSAIDs classification, very important, and the specific indications also. Study the classification of anti-rheumatoid drugs and anti-gout drugs. Focus on mainly DMARDS drugs, very important, and the drugs for bronchial asthma. Just study the classification, and anti-thyroid drugs with their MOA and their specific indications and the classification also, very important, and study the insulin table, the types of insulins and their anti-diabetic drugs, very important, and the androgen drug classification, focus on the anabolic steroids, etc. This classification of scheduled relaxants and local anesthetics. The classification of local anesthetics is very important for both medicinal chemistry and pharmacology also, very important, and study the page number 430 of KD3 Party tape of 8th edition, very important, and very important, the anti-epileptic classification, MOA, and the table of specific drug of choice, which is in 449 of KD3 Party 8th edition, very important, and study the MOA and classification of anti-Parkinson's and antidepressant classification also, very important, and focus on the opioid analgesics and the specific receptors also, like mu receptor, kappa receptors, etc., and the specific locations, and study the antagonist, the classification, and complete study of cardiovascular system is very important. Focus on all the classification of cardiovascular system and the diuretics also, both for medicinal chemistry and pharmacology. Diuretics are very important, and the anticoagulants, antiplatelets, the classification, the specific MOA and specific indications, mainly the aspirin drug, very important, and just study the classification of peptic ulcer and study the antifungal classification and their MOA. Very important for both medicinal chemistry and pharmacology. The MOA is also very important. The specific enzymes present in the antifungal is very important. And just study all the classifications of pharmacology. You can expect nearly 3 to 4 questions directly from the classifications itself, and mainly the antiviral and anti-cancer classifications are very important. So 1 questions will come from this antiviral classification, that is of page number 849 and 861 of KD3 Party, and the 916 page number of KD3 Party of cancer classification, very important, and the immunosuppressants also. So antiviral, cancer, immunosuppressants, antifungal, the CVS system, these classifications are very important, and also look at the classifications of anti-malarial drugs. And for pharmacology, read all the classifications and the specific MOAs and the specific indications also, and the specific adverse effects. So these things you should focus on the pharmacology. And for HAP and pathophysiology, clear your basics on HAP. Only basic questions will ask from human anatomy and physiology, and some specific disease deficiency diseases and some general anti-inflammatory things will ask from pathophysiology. So all the best. Subscribe to this channel and share with your friends.